Hello and welcome to Medicine Across Borders,
where we explore the global tapestry of healthcare
and challenges shaping healthcare systems worldwide.
Share your thoughts and rate us on our social platforms to help us continue bringing you content on global healthcare.
Hello and welcome back to Medicine Across Borders, our podcast. And with us today, we have a very interesting episode. We have Dr. Jawień, vascular surgeon, and Eimear Bruton, both from Poznan University of Medical Sciences. Dr. Jawień was one of my teachers at medical school, so I know him from previous years. But I think this is going to be an extremely interesting episode, a fantastic opportunity for many medical students. And that opportunity is the Summer Vascular School, which is in Poznan, in English. Now, can you quickly kind of kick things off, what is the Vascular Surgery Summer School?
I'll try quickly. Blood and gore in Poznan. Do you know, or maybe remember, what we in Poland call the White Death? There's a saying in Polish, and it has to do with sugar and salt. But many people also recognize the fact that healthcare is sometimes considered as white death. What am I exactly talking about? The fact that doctors make mistakes all the time. It is normal to have complications, but it is unwanted. And as education shows, the best way to learn is to learn by making mistakes. And as many things have proven, also great books and films like Ender's Game, the best place to learn is in a safe environment where you can make a lot of mistakes. And that's why we came up with this idea of workshops. Very often during, for example, your regular classes, which you probably remember much better than I do, everyone is constantly stressed that even if they ask a question, if they make a mistake, if they make a mistake on an exam, that will be penalized. And in effect, they're worried about mistakes. But if we actually want to learn anything, we have to make as many mistakes as possible. And that's why workshops, like the one we are trying to organize here in Poznan, is something that a lot of doctors or future doctors, like students, look forward to. At conferences, for example, because they know that they will be working in a safe environment where they are allowed to make as many mistakes as possible, discuss these mistakes, and receive the feedback that allows them to get the appropriate knowledge that allows them to make better decisions and less complications in the future for their patients.
Okay, so this is a summer school for vascular surgery being the main kind of topic. How long is this? Where is it taking place?
Given the fact that we would like this to be not too long, not to bore the people with all the things that we would like to show them, but at the same time to have the necessary quality of an experience of what actually is done, we're looking at a week, 5 work days, in the Department of Vascular Surgery, a week where we get a chance to explore all sides of vascular surgery, not just the operating room, but that, of course, is a big element, but also the outpatient clinic, which is necessary. Also, our day in the cath lab or the ultrasound lab to have a chance to look through the full spectrum of what it is to be a vascular surgeon.
Okay, and this is going to take place from the 1st of July, I believe, right, till the 5th of July?
Yes, so it's the 1st to the 5th of July. The idea is, again, as Dr. Jawień said, Monday to Friday. We just want students to come and have an immersive experience for the week. So the 5 days are quite intense in the sense that, you'll really be put through your paces. You'll definitely improve your skills, but we think it's the right period of time. It's not too short and it's not too long. It's just the right amount of time for students on the ward.
Okay,
and
perfect.
If you're comparing it to regular classes, regular vascular surgery courses that students take when they're during their med school, you could say routine, this here is going to take place when we don't have other students coming in. And as you well know, you can't have quality with large numbers. Anywhere you go, if you want the best experience, you want a limited amount of people that can participate with the doctors who have time for them. And this is the case that we're dealing with here. We're going to have a week with a small group of people who are interested in the topic. And that's also something that we see at conferences, where you have workshops where people sign up, are in a small group with a team of educators who have their time dedicated for that purpose only. And I can't compare it in any way with a regular teaching routine, which of course has a lot of setbacks.
I think we're going to get into the kind of the juicy details of the course in a second. But what I wanted to also mention, especially early on, is how the deadline for the application is the 31st of May. So very, very soon. There's not a lot of time. So anyone who is listening to this podcast, I'd really, really recommend to get an application sent off as soon as possible, because there really isn't a lot of time left. We're going to get into how to apply and things. Yeah.
And we have to stress, before Eimear explains the application process, we can't have a lot of people coming in. This has to be a very limited experience. We want to work closely with the students that participate. So analyzing the possibility of people taking active participation in surgeries, in outpatient, at the ultrasound lab. We're looking at a maximum of 8 people joining us so that all can benefit from the experience. If you could tell us how the application...
Yes, of course. So the application is nice and straightforward. We have an application form where we ask some simple questions, just your motivation for joining us, what you think you will gain from the program. And then we also ask you to submit a CV and a cover letter. But I understand, as a medical student myself, CVs, they're not always as complete and as glowing as you'd want them to be. We understand that you're students. All we're looking for is just motivation. Mm-hmm. We just want to see that the students that are coming to this program are going to get the most out of this program, because like Dr. Jawień said, it's a small program. We only have 8 places, but we want the 8 people that come to really, really maximize the teaching experience that we can provide to them.
All the links will be available in the description. You have an initial form which needs to be completed, correct? You have a CV and a cover letter.
Yes, initial form just comprises of your name, your date of birth, the school you're at, the year you're in, because we want to make sure that the students have finished their preclinical years. Absolutely. So we're looking for 4th year, 5th year, 6th year and onwards. If you have actually graduated and you're interested in the program, you're still welcome to apply, because like I said, it's motivation based. We're not interested in whether you've been in the OR many times or whether you've never stepped foot in an OR. We just want to see that when we take you to the OR, you maximize the experience. So that's what we're doing with the application form and the questions. And again, with the cover letter, it doesn't need to be anything more than 300 words. We're not looking for essays. I don't think you have the time to be reading loads of essays, and I don't with exams coming up. So
surgeons are not good at reading.
So I'll have to do it then, which is not something I'll be able to do completely. So I think, again, just short and sweet. Just why you think that you would like to come and what you think you could take from it. That's it.
Okay, great. So we fill out the application form. We have a CV. If anyone hasn't created a CV ever in their life before, then I recommend using Europass. It's a very standardized way of doing it. And that also can be really, really simple, short and sweet. Don't worry too much. Don't get bogged down in details. And then there's the cover letter, which maximum of 300 words. And once you've completed those, we send them off to an email, correct? To your email?
Yes. So you send it to our email account, dluga.vascular.surgery@gmail.com. But again, I think we'll send you that information and you can link that with the podcast. And it's just as simple as that. It's just sending off the 3 things. It's more of a formality, like we said. It's really just to see why you're interested in joining us in July.
The deadline for that first submission is around about the 31st of May. It is the 31st of May, in fact. And then what happens next? I've sent those in. What are the next stages?
So then we take a look at the application and we narrow it down to the 8 candidates that we think would benefit the most from this program. And then we hope to have email correspondence out to all applicants, successful or unsuccessful, by the 10th of June. So it just gives us maybe a week and a half window to have a look at these applications. And then the successful candidates will receive the welcome pack, and I know we'll talk about that in a few minutes and what's involved in the welcome pack, but that's it really, just email correspondence.
Okay, and this is a very feature-packed, very intensive course, and so it is a paid course, but we will kind of go into detail as to why and what are you paying for and why the price is so much, or so little even. It depends how you look at it, but it's 400 euros, correct? The fee that has to be paid, and that has to be paid once you've been accepted. So on the 10th of June, you're accepted, and then you have maybe a week or two. I think you will be sending some information out as to the deadline for the payment, but it'll be around about mid-June for the payment deadline,
yes.
Correct?
Yes. So the idea, again, is that with the welcome pack, you'll receive all the information you need, and you'll also be told about how to do payment. Payment isn't handled by the department or by us. It'll be handled through the conference office at the university. So it will just be a matter of the student sending the money directly to the university. So we're not handling the money directly there.
Yeah. Sticky fingers, but primarily for catheters and and other instruments. So money is an important issue, but just to stress out, unfortunately, initiatives like this take time and require funds to organize. And we want to secure a place for all of these students who will be coming, a place to stay, appropriate food, and also attractions happening outside of the workshops in their free time, so that a big part of their stay here is not just vascular surgery, but meeting the people who study here, and with this experience also gaining a lot.
So yeah, that's a good point. Let's talk about what the fee is going towards, because from what I understand, you're not getting a penny. This is all pro bono.
Yes, I can talk a bit about that, because I think it's unfair for him to talk about his charity work on a podcast. We'll make him look too good at this point. So the 400 euro goes towards your accommodation and your catering. Your catering is 2 meals a day, and again, it's provided on campus, which means that in the morning before you go to the hospital, your breakfast is there for you. You head down to the bistro, and then we all gather and we go to the hospital. So you are guaranteed that you have your accommodation sorted, you have your catering, and then as well equipment for the program, anything that we require. And if you really look at it on a whole, to spend a week, 5-6 days in a city where you have 2 meals a day and you're also attending a summer school, 400 euro is a fantastic price. And I'd also like to add that everyone involved is actually working pro bono this summer. So if you step back and look at that from a financial point of view, how much are you gaining as a student when in a year or two's time this program could be 3 times the price? Because I don't think I'll be able to con them into doing it free again.
Yes.
So
it might be an issue. There's quite a few people involved, a lot of my colleagues as well, who are willing to, let's be honest, try this out. This is a new idea that we have. We thought about this when we met with others at conferences at the ESVS, which is the main society that oversees vascular surgery in Europe. And it has a lot of initiatives for young people. And we thought about, let's spread this and make this something even more for future vascular surgeons. We should be telling young students that maybe this is a career choice they should be looking in. Maybe we're telling them too late. Let's start off when they're still studying. And so we're trying this out. We want to see if people are interested. We want to see if it works. We want feedback. So I'm not going to lie. We would be very thankful if the people that join us for this experience also let us know if it's worth it, if it was worth their time and worth our time. And in the future, like Eimear said, unfortunately, the prices, if we continue doing this, would have to rise significantly, because we would have to start paying the people working for us, as they are now doing it only out of their good heart.
Also, I'd like to add from a student's perspective, because I work within the department quite a lot, but the people that are involved in this program are highly skilled and they've achieved a lot in their careers. And the fact that you're coming to this, I mean, you're doing it pro bono is one thing, but from a student's perspective, the price really doesn't reflect the standard of teaching in the sense that you should be paying a lot more to have the experience that you're going to have when you come here. So I think that's a big takeaway just from a student's perspective. If it's something that you would be interested in doing, I would say this is a very good year to do it from a financial.
So in future years, we can expect the price to kind of also increase. So in many ways, if someone wants to do it, now is really now is the time. You know, you pay a bit less. Fantastic opportunity. But I also know, Eimear, you've had a bit of experience into applying for other summer schools. So do you have like an idea of how much do generally summer schools?
This is something I was quite passionate about and why I came on board with the team as well, is that I had applied to summer schools that I had been denied. And the reason I was denied is because in the end, there was an influx of applicants and they prioritized interns, which I understand interns need the training, but it did make me question, okay, where is somewhere where I can go then? Where is somewhere that I can improve these skills? Because although I am someone who would like to do vascular surgery and have an interest, I do think that there are a lot of aspects of vascular that can be applied to other areas of medicine. For example, the diagnostic aspect. If you're coming to this program and attending a workshop in ultrasonography, that's not something that's specific to vascular surgery. If you're working in the emergency room, it's very likely that you would have to perform some kind of ultrasonography exam. And I don't think it's something that would do any harm to students, even if they're not looking at vascular surgery as a whole. I think this program provides a wider subset of skills that can be applied within the field.
It broadens the horizons, and it's exactly what I've been saying at the ESVS meetings. We would often hear that we're trying to promote all these things among students, but they don't have a place where. Yes. It's always the interns or the youngest residents, and they're always somewhere in limbo, and there's no place for them to experience what they might be doing in the future, or allowing them to define whether they want probably to do something else because it's not what they want to do. But with this background knowledge, they can still help quite a few people.
And who is this course specifically for? I think we've kind of touched on it earlier, that there's only 8 spots. So once again, make sure you get that application so you don't miss out. Only 8 spots. But who is it for? Kind of first year apply? Or is it, are you expecting a bit more experience?
Exactly what you're saying. We need people who have an understanding of the basic sciences. We are going to go into detail about certain vascular, both pathologies, the physiology of the system, and we can only build upon something that these students already possess. So they need their basic skills. And that's why we're looking at students from the 4th, 5th, and 6th year. This is our primary group of students that we would like to invite to join us for this experience.
Okay, and actually kind of touching on that, because you mentioned 6th-year students now. Some people may have graduated or are about to graduate, but because this is such a hands-on practical course, I think it is something that would be very useful for people, applying either to maybe the Polish internship stage, maybe to the UK foundation program, or maybe to that Ireland 1-year internship. I think that is very, very useful for the practical skills for those kind of individuals. So you're telling me that if they're in those final year, or maybe they've just graduated this year, that they're still absolutely eligible to apply.
Yes, I think, again, from any experience I've had talking with students, even those about to graduate, I think you're never fully developed with your skills. I think there is always the opportunity to further your skills. And if you especially are about to walk into a hospital in 2 or 3 months' time and begin practicing medicine, why not brush up on the skills that you're going to be using while you're there? Because we're looking at vascular, but again, we're looking at the diagnostic side, which means that you can apply that to other areas. You don't just diagnose vascular diseases, you have to diagnose an array of pathologies within medicine. And again, I think it's just a nice refresher course. And from a student's perspective, it's difficult sometimes to get experience in the operating room or to have one-on-one time with a surgeon that ensures you can develop your skills in a very personalized manner. So again, this program speaks to those who would just like to really boost their confidence and their skill set going into the working environment.
And I'd like to add, as we often have internships outside of our hospital, and we travel to various places as doctors, also for that purpose, to be able to observe how certain things are done differently, because you can do things in one way, but also you can do things in a different way. And that's also why we're trying to invite students from a different university. We want them to come and see our methods and discuss with us on the pros and cons. Maybe they'll accept what we do here as something that might be, sorry to say, superior that what they're used to, or maybe they might teach us. It's a way of exchanging all of these methods and ideas. And it's the only way to do it, with this sort of close and personal experience in these workshops.
I hope it opens the door as well, because I've not had a lot of summer school opportunities because I'm a medical student. So I hope this opens the door for other departments to look and maybe go, actually, you've taken some of our students in Poznan, we would love to take some of yours now. And it opens the door for people like me to go off and actually, expand on my skill set and then see if they're superior or inferior based on their teaching standards as well.
So I also wanted to ask, because here in Poland, you have a lot of universities have something like a summer practical, right? Maybe like 4 weeks during summer that you're doing something. How is this different to that? Or why should someone go to this course? What if, for example, someone isn't interested in vascular surgery? Is this only for people who are interested in vascular surgery, or other kind of topics as well?
I can speak again from the student perspective and then from the teaching,
absolutely.
But I have done summer practicals and they've been fantastic. Summer practicals give you the opportunity to apply what you know. However, when you're on a summer practical, you're on a busy ward and sometimes you don't get the attention, I suppose, that you would like. And it's difficult to demand that attention from a doctor when they also have many things going on in that moment in time. But with this summer school, the surgeons and doctors that are here, they're here specifically for you. They're here for your training and for your teaching. So it's very individualized. And as well as that, we have 5 surgeons on the team and we have 8 applications. That's the amount of places we have. So it's nearly 2 people per 1 surgeon, if not, more or less. So it really implies that the focus is on you. When you come here from the Monday to the Friday, it's about you. It's not about, I need to go and do rounds and I'll come back and tell you what you need to know. It's about, we're going to the OR, me and you. You're coming with me. I'm going to show you what we do. You're going to help me do what I do. And things like that. That's from the student perspective.
It's
okay.
It's exactly what I wanted to say. I just wanted to ask you, Eddie and Eimear, what was your experience? Because I know for a fact that we do not have that time and dedication to the students doing their practical summer activities. We know that they're there. Sometimes we have a moment to chit chat with them. Sometimes randomly we find ourselves with them in the operating room and we expect more of them in terms of get this done, and we just want to see the result. Here, we're not about that. Here, we're about teaching you, seeing if you're making mistakes and correcting them as we go.
Okay, now let's get into actually what is this week really going to look like. So I believe that the course itself starts on Monday to Friday, but you have accommodation in there. You also have the 2 meals a day catering. What does day 1 look like?
So before day 1, I want to quickly talk about orientation, because I think I don't want to give the impression that you land in Poznan and we don't see you till 8 a.m. Monday morning. We will be there to help you. So we would like to have a sort of mixer in the evening. So Sunday evening when you arrive, we have a mixer. You meet some of the people in the program. Myself, I will be there. Dr. Jawień and a few others most likely will be there. And it's just to sort of put a face to the name before you start Monday morning, and also to talk through what is expected of you and to ask what is expected of us. Because like Dr. Jawień said before, we want to make sure that whatever we're doing is for the benefit of the students attending. There's no point in us having 10 goals, academically speaking, that we want to get through if only 8 of them are applicable to the students that are coming. Mm-hmm. So mixer first, which is very informal, be a nice evening. And then Monday morning, we all head off to the hospital. So in the mornings, we're planning case discussions, lectures, seminars. It varies. So the program is still being discussed, but the main aim in the afternoon is workshops. So we have endovascular workshops, we have diagnostic imaging workshops, and they're all ran within the hospital. We have suturing workshops. So more advanced suturing. So we can help the students who have not had any suturing experience prior, but also those who are looking to do something such as anastomosis, perhaps a little bit more challenging in the OR. And then we also, towards the end of the week, have outpatient clinic. We also have surgery rotation, so you'll be in and out of the OR, assisting, watching, asking as many questions as you can of the surgeons. That's my advice. Make sure to use all the time you get with them. And then also a panel discussion. So on Friday, we're going to have a sit down with these surgeons, and any questions you have will be answered if they've not already been answered, but also just for them to talk to you a bit about their career, how they got where they did, and also what is expected of you in the future, and what life brings as a surgeon, as a clinician.
Yeah, and that's the big difference. They're not going to be asked at the end questions, and they're not going to have a final test. We are.
Yeah, the limelight's really on you guys on this one.
Every day is split up into, let's call it like 3 sessions, right? It's Monday, afternoon, evening, something like that.
Yes.
And, this isn't a case of you go there, you sit down, listen to a seminar, just kind of wait till the clock ends, right? So what kind of things can people expect to learn? What kind of skills? Are they going to be going to the OR? How often are they going to be going to the OR? How involved can they be there? And these practical skills, what kind of things can we expect for students to be doing?
We definitely want to see them, the entire spectrum of what happens in a vascular surgery department. Not only that, we want to see them, we want them to see what happens from the perspective of the patient. So we're going to follow them through. We want these students to participate actively in the outpatient clinic to see what it comes down to when we decide on the types of treatment that we have for our patients and how we qualify our patients for the various procedures or not. We want them to be at least one day in a imaging laboratory that we have with ultrasound to be able to see how we use non-invasive techniques to identify the problems, verify the problems, and possibly make our decisions based on these methods. We want them to have a day dedicated to suturing and the open techniques in surgery that we use in vascular surgery, where they get to know and understand the instruments we use and the basic skills that we have that make it possible to perform open surgery. We want at least a day in the cath lab to have an understanding what the endovascular procedures are. And we want a day in open surgery. So as you can see, given the week, we're going to basically just make it in time to squeeze all of that and make sure that everyone experiences it. This is a dream that has never come true when it comes to regular classes. I have the privilege of coordinating the vascular surgery course in Poznan, and we've often debated if it would be possible to make this regular type of schedule for each group that comes in, so that every student has a day in outpatient, has a day here, has a chance to see this. In a normal workday scenario with 20 students or more, and the Polish program hanging on as well, it is impossible and has never been achieved. So here we're trying to see if it's something that is possible for a specific group, a small group, and a dedicated group of doctors in 1 week, an experience which we, up until now, had never had a chance to perform or to take part in.
So I know from classes that sometimes you'll have a scenario where maybe your group is 5, maybe it's even larger, but so sometimes you go into the OR and maybe one person will have the opportunity to be a bit more involved, but the rest, realistically,
after a year, exactly,
they're all stood behind. They can only see the screens. My question here is also, will students have potentially the opportunity to be able to assist in
yes,
surgeries?
Absolutely, yes. We're placing a stress on that. We will be looking at certain patients. It's a bit too far away from July at this point, but in June, we will be qualifying patients for surgery in the first week of July so that we can ensure proper experience immersion in especially in the operating room and the cath lab.
Okay, great. Let's say a typical day, it starts around 8 a.m. after you've had your breakfast, and then you have that first session till about 9:30, and then you have a second session from 10 till around midday, and then from around 13, so 1 p.m. till 2 p.m. is kind of third session. So every day I have these 3 sessions, which end up being from 8 till 2. It's super intense, super hands-on.
It is.
That's what
and
you kind of expect.
We have to understand that this is surgery. It's not the airport. We're not going to be going exactly by the clock. When a patient is rushed in, we're going to rush in with them and skip the seminar, as you call it, or more commonly an overview of the specific case, the patient, and then we can discuss it also afterwards. So we're going to adapt depending on the given situation in the ward at the moment.
Okay. And then I just also wanted to touch on, I think you have a few plans of what to do afterwards, because you have these intense hours. Yeah. You gotta have a bit of relax after.
We've got to have a bit of fun. I know we're going to leave the surgeons behind and we're going to have some fun, but the idea behind it is that we want to show you the city as well. If you're coming to the city and you want to experience Poznan for what it is, you can't do that from within the 4 walls of an OR, with respect. They will have a great time in the OR, but they will have to go and do a lot more. So sightseeing, we have a tour guide planned, we have social evenings. Also, dinner is included in the price, but if students want to go out and explore the town and have a meal, there's only 8, and hopefully they let me tag along as well. And if they do, that's 9, and that's not too many to go out and have a meal and get to know each other a bit more. So we understand that although you're here for a summer school, that it's important to de-stress as well and go and enjoy yourself in your downtime. So we've allowed the opportunity for students to do that also. Okay.
So to sum up, you arrive on Sunday, you have a little bit of an orientation, say hello to everyone. Then you have accommodation every night till Saturday. So on Saturday, most people will be leaving. And the course itself is Monday to Friday. So Monday to Friday, you'll be doing the course up till 2 p.m. Some other events after the course every day, kind of more relaxing ones. And then on Friday will be the closing and saying goodbyes and the presentations. And then still certificates, yes. And then then you still have that one night, and then on Saturday you're off. That's the summary.
I think it's important as well. That's why we have the orientation evening, is that if there are certain things that students would like to do or would like to arrange to do, we discuss them on the Sunday evening. So again, we have a course structure, but we want to hear from students. So, if you have students in the evening saying, I have an interest in history, I don't really want to go out to the park for the evening, I would like to go and explore XYZ, that's something we can do. So again, it's all down to those who come and what they would like to get out of the program.
Okay. I also wanted to kind of ask and touch upon, because you mentioned that there's 5 surgeons. So at least comparing to even classes or to courses that I know, that's a lot of surgeons per students, right? 8 students, 5 surgeons. That's a lot. But maybe could you go into a bit of detail as to who's a part of your team? Maybe we could kind of start off with you, Dr. Andrzej Jawień.
Me?
Yeah.
We have a very nice representation of female surgeons. We're going to have 2 that will help out with the program, Malwina Grobelna and Błaszak. Unfortunately, they're younger than I am. I am the senior on this experience. We also have Szymon Salamanga, who is our resident in vascular surgery. We also have Hubert Stępak, who I have to mention, and unfortunately he can't be with us here today as he is in the operating room as we speak. And he is you could say, course coordinator. And if anyone's interested in more info, you can find his videos on Instagram promoting this summer school, so you'll get a chance to have a peek at what he looks like as well. He's a close friend of mine and an excellent doctor. And of course, lastly, myself, I am a vascular surgeon and have worked in the department for the last 18 years. And I've also had the privilege to teach students in that time, also both the Polish program, the English speaking program. So this just expands on my experience in teaching and hopefully will give me new insights and new ideas for the future.
If it wasn't clear already, the course is entirely in English, but Andrzej, your accent is clearly quite good. You spend a bit of time in the US, correct?
Yes, but a very long time ago, before you were born, if I remember correctly. This was in 1988 to 1991. I was there as a child in Seattle, Washington, tagged along with my parents, of course. My dad got a scholarship in Seattle. He's a doctor as well. And I had the chance to live in Seattle and learn English in the natural way, going to a normal elementary school near Seattle.
Just to add as well, I think we have an Instagram page. The department has an Instagram page, which again, we'll link down below, I think, in this podcast. But that is the best way for you to see the team and get to know the department, because in the next few days and coming weeks, we're introducing the team. So we're starting to put out bios for the surgeons. We're starting to put out more course curriculum. So you really can see what you're signing up for. And there are videos, as said before, with Dr. Stępak in, and you can see I'm also in some of them in the OR, and he is teaching me, so there you go. They're true to their word videos, so you can see exactly what you would expect from the program, which is being stood right next to them telling you, come on, let's go, you've got to get in on this, you can't stand there looking, you have to do. So.
And what do you hope that students will take away from this course?
Okay, from a student perspective. From a student perspective, I hope they take away confidence, and that's a big thing. So, for example, I work here a lot. I work in the outpatient with Dr. Jawień, usually on a Friday, and sometimes the most daunting things are the simplest things. For example, when you're doing an exam of peripheral limb and you're checking for pulses, this is something that the surgeons do every day and something that you do. I think sometimes you just look at the leg and know you have the ability. And sometimes in the past, I have not known how to do that, or I've not felt confident. And being around a teacher that not only wants you to learn, but ensures you learn. So you don't just say yes and move on. He will say, okay, where do you feel it? Tell me why you feel it here. Tell me why you don't feel it here. So you really do gain confidence in your, I would say, even simple diagnostic skills, but skills that you really, really need. And then again, I've worked here 3 years with the department, and I'm hoping what students take from this program is that everything I have learned in 3 years, they will learn in 5 days. That's how intense we're trying to make it, because they've really taken me under their wing. I've had the opportunity to scrub into many procedures. I've really improved my surgical skills, my diagnostic skills, and then because of that, my confidence as a future clinician. And that's what I'm hoping students take away from this program. No, from teaching.
Wow, I'm getting teary-eyed.
Oh,
I'd love it for that to be something that they take away. Obviously, what I want students to take away from this as well is that we're one big team. Surgery is a team sport, but doctors, we're one big team, and it's very important that early on we understand, also as med students, that exchanging our ideas, going to other places to see different methods of diagnosis, treatment, whatever, really broadens your horizons. And it shouldn't be just this trip to Poznan. It should be trips in the future as well. I want them to understand that investing in this way in themselves, they're actually helping a lot of people that they will be treating in the future.
Okay, and what do you think students are going to be most excited about?
I go first. The OR, the gory OR.
Exactly.
I think
blood and gore. It's what students always like. We always tell them that there's nothing special about it. When they come and see me, the first thing they ask is, "Are we going to see an amputation?" Right? It's it's the least spectacular type of surgery for us. It's a sad way to end someone's critical lower limb ischemia. You could say fight. And we do it very often, but there's so much more to vascular surgery, and hopefully they will see that beyond this blood and gore, there's so much more.
But I think the OR, again, having the opportunity to use your skills, because like we've said before, I've worked with many fantastic clinicians, but unfortunately, time is always a restriction or availability is a restriction. So having these people who have dedicated their lives to improving their professional skills throughout the years, standing in front of you going, ask me, let me help you, is a very big draw for this program. And that's what I would be most excited about, because even still coming to the department now, you know, it's, every day is a new day. You see something new all the time. Hi.
Yeah, I think he's one of the surgeons
One of the
on the
surgeons. You
team.
should
Can he
come
put
and
his
say
head
hi.
and say hi?
Say hi.
Yeah.
Okay, sure. Come here. I'd like to introduce Shimon, our young resident, but a very hard worker, so you'll get a chance to see him in July as well. Say hi, Shimon.
Hi, how are you?
Okay, perfect. Thank you very much. We'll see you very soon then.
Yeah, fantastic. Thank you. See you.
All right.
So
you need to
I
say
actually also
else?
just wanted to, because we're finishing off now, so I just have last one. Regarding requirements, what do people need to bring for this?
So for the course, no different to any other hospital rotation. So you need your scrubs, your change of shoes, you need your white coat and outpatient outfit as well, because on Friday you'll also have your certificate presentation. So you can wear scrubs, but if you wanted to wear an outfit with your white coat, students are welcome to do that as well. And then the most important thing to bring...
Smile and good spirit. Spirit, not spirits. Spirits are in the evening, right?
Extracurricular activities are not to be discussed with the surgeons on the team.
Okay, perfect. So once again, to just kind of quickly sum up, the deadline is 31st of May. Make sure that you fill out the application, get it sent out by that date. Otherwise, you're going to miss out. There's only 8 spots, so it's super crucial that if anyone's watching this and they're not sure, just send it and see what happens. And by the 10th of June, you'll get a response. And around about mid-June, you need to make sure that you pay the €400 fee. The course itself starts on the 1st of July and it ends on the 5th of July. However, you will have accommodation from Sunday to Saturday. So that is the
30th to the 6th. Yes.
The 30th to the 6th. So you have accommodation from the 30th to the 6th. It's catered with 2 meals per day for the 1st to the 5th. Get it sent out. Next year is going to be more expensive, so don't miss out. And I hope everyone takes advantage of it. And I'd like to thank you both very much for coming on the podcast, and we hope to see more of you in the future soon. Thank you very much.
Thank you. And we hope to see as many as possible in Poznan. We really hope that some of your listeners do come, because if they're listening to your podcast, they're interested in expanding their skills. That's what we're here for.
Thank you, Eddie.
Perfect. Thank you very much. All the best.
Bye-bye.
Thank you, everybody.